Everyone, so we're going to be switching. This is one of the last, I think second to last wellness lectures. I am going to be presenting on imposter syndrome, as hopefully most of you guys know, Priscilla. So before we begin, I want you to raise your hand if you have had any of these thoughts cross your mind before, during, after shift, during your day-to-day, thinking about yourself as a medical doctor first. Have you ever had this thought, thinking they, and you never know who they are going to find out I'm not supposed to be here, or I'm not as qualified as they think I am. Or another thought, you love a compliment or saying that you're great, you did a great job for about 10 seconds, but on the 11th second you think, oh my God, they think I can actually do this. Another thought, how many of you are such perfectionists that you do 10 things right and then one thing wrong, and all you can think about is just that one thing? And lastly, how many of you don't know how to say no because you have to be everything for everybody, for fear if you don't do something, you're not good enough? These are some questions. If you've ever thought of these questions, you probably have something called imposter syndrome. I'm sure many of you have heard of this syndrome. These questions are something that Dean Ashby, she's the dean of the Duke University College of Arts and Sciences. She talks a lot about this syndrome, which she endorses about herself as well. So today what we're going to be talking about is what is imposter syndrome, who does this affect, why does it even matter, and how do I overcome it? Imposter syndrome was first described by psychologists Clance and Eames in 1978, where they found a phenomenon that occurred among high-achieving women who were unable to internalize and accept their success. The definition is that this occurs in high achievers who are able to accept their success and attribute their success to external causes, like luck, error, or knowing the right person. And that they are fearful that others will unmask them as fraud. According to the American Psychological Association, it's not an official diagnosis, but it's a specific form of intellectual self-doubt. When in Clance's original paper, she talked about 6 characteristics that describe imposter syndrome, or 6 characteristics of individuals who have imposter syndrome. I'm going to shorten it to IS moving forward. So this illustration describes the first characteristic, the imposter cycle. So first, the person has a task, they develop a lot of anxiety over this task, then they start over-prepping or procrastinating, and they start, so this like overcompensation with frenzied prep. Then the task is completed. They feel relief, but this relief is short-lived despite positive feedback. And the person believes that the success is due to hard work or luck, not due to their innate ability, which then leads to self-doubt, depression, anxiety, and tendency to overwork. And then it just repeats itself. So the other 6 potential characteristics that Clance describes about those who have imposter syndrome, the first, as we discussed, was the imposter cycle. The second is the need to be the very best, secretly comparing themselves to others, which causes them to have this feeling of inadequacy. Superwoman or supermen aspects, the need to be the very best. People with IS have sometimes set unrealistic goals for themselves. 4, fear of failure. 5, the denial of competence and discounting praise. Individuals who have IS have difficulty internalizing success, make excuses why the praise is not deserved. And fear and guilt about success. They feel isolated in their success, and they have fear about taking more responsibilities, as they are more likely to be found out when they have these higher expectations. Dr. Valerie Young is an individual who talks about imposter syndrome. She does a lot of TED Talks about this, and she wrote a book called The Secret Thoughts of Successful Women, and she broke down these 6 characteristics into personality types, and they sound similar to the characteristic. One are those who are perfectionists, people who set unrealistic goals and feel like failures despite the level of completion of their goals. Second, experts, people who need to know every piece of information and will over-educate themselves. They also are afraid of looking stupid and will hesitate to assert themselves. Third is natural geniuses. These are individuals who were used to achieving success effortlessly, which leads to feelings of inadequacy when any effort is needed. Soloists, people who feel that asking for help is a sign of failure. And fifth, the supermen and superwomen, people who need to work harder than everyone else around them in order to succeed in all aspects of their life. Imposter syndrome affects 70% of high achievers at some point of their careers. Pretty common. Factors that can contribute to having IS. The original study performed by Krantz and Eames found that IS is more prevalent in females, and older studies support this. In the original study, they said that the sexes perceive success and failure differently. In terms of success, females attributed success to temporary causes, luck, or effort, not ability. Males attributed success to their innate ability. As opposed to failure, females thought it was because of their own lack of ability, and males thought it was just due to external causes such as luck or task difficulty. However, recent studies show that it affects genders equally, actually. Being a minority. So in 2013, studies found that Asian Americans were more likely to experience IS more than their counter African Americans or Latin Americans, and that IS in particular strongly predicted mental health problems more than stress related to one's minority status. And here, for us in medicine, there was a recent review assessing IS in physicians. The prevalence of IS in med students is a pretty wide range, 22 to 60%, and in residents, 33 to 44%. So does this data reflect us residents in our particular residency? I sent out a survey to our alumni, and I got 37 responses, and 78% had said they had experienced imposter syndrome at some point. 25 responded that they felt it during residency. 27 said they felt as a new attending, and I put new attending as 1 to 3 years out of residency. And of note, this question was selected, you could select as many as you wanted. So I put med school, residency, as well as a new attending. 12 marked during residency and as a new attending they felt IS, and 11 marked throughout their entire career, med school, residency, and new attending. And only 8 people out of 37 said that did not experience IS. So why does this matter? In my previous lecture on physician mental health, I talked about some pretty stark statistics about physicians dying of suicide. Majorities of studies have shown an association between imposter syndrome and increased rates of anxiety, depression, and burnout. It also correlated with increased levels of emotional exhaustion, depersonalization, cynicism, and decreased rates of job satisfaction. In one study, 67% of practicing physicians and 76% of residents are experiencing burnout. If we can mitigate this associated factor, in this instance, imposter syndrome, perhaps we can improve the burnout rate in residents and practicing physicians. So if you identified with anything thus far in this presentation, and you said, yes, I have imposter syndrome, what can I do about it? Here are a few different strategies. A review of the imposter syndrome literature found one article that discussed recommendations to address imposter syndrome on an individual and institutional basis. For individuals, they recommend this paper said, keep a record of successes and positive feedback, celebrate your accomplishments, and seek mentors and supporters. On the institutional level, they recommended workshops on imposter syndrome, develop mentorship and support programs, and fostering a culture that does not punish mistakes. On the institution, and then another article found that certain factors protected against IS in those in particular in medicine, and they included social support, validation of success, positive affirmation, and institutional support. So similar to what this other paper said. And there's something called the 10-step method. It was published in the American Journal of Pharmacological Education, and I got this 10-step method from this paper in particular because the grad student, he was a psychological grad student, And he described how he utilizes 10-step, which also Dean Ashby discusses, and Valerie Young as well. Dr. Valerie Young. The first is breaking the silence. When you make a mistake, tell somebody instead of playing that tape on repeat over that you did wrong over and over in your head. Ask them, does this make sense? The feeling I'm feeling right now? Did I truly make a mistake? And they'll likely say that it makes no sense. Change that tape. By sharing your experiences, you may discover that someone else has a similar experience as you. And you say, hey, I have imposter syndrome too. And by having this discussion, we normalize the feeling of imposter syndrome. Second, separating feelings from facts. Just because you feel stupid does not mean you are stupid. Recognize when you should feel fraudulent. Self-doubt, which can be a normal and appropriate response, but we have to recognize that sometimes there is a time for an appropriate, there's an appropriate time for an appropriate amount of self-doubt. Like the previous slide said, accentuate the positive. Those of us who are, we're all a lot of us are type A, we got into med school, so forth, and we came into residency, and there's a level of perfectionism and perfectionism means that you just care really deeply about your work, but perfectionism is not attainable. The key is to continue to strive for excellence where it matters most. Don't persevere over routine tasks. Forgive yourself when mistakes happen, because they will happen. And developing a new response to failure and mistake making. Try to stop the rumination and bigging yourself up. Henry Ford said, failure is only an opportunity to begin more intelligently. 6, write the rules. These rules that there's always this preconceived notion that you must know all the answers and do everything yourself. We are allowed to be wrong and ask for help. Load the book. 7, develop a new script. Know your triggers and what causes you to feel off. Recognize your internal script. That script of saying your internal voice saying, wait till they find out I have no idea what I'm doing. Instead, think, everyone who starts something new feels off base in the beginning. I may not know all the answers, but I'm smart enough to find out. 8, visualize your success. Focus on the 10 things that you did right that day, instead of that one thing that kept going wrong, or one thing that you keep focusing on that you did wrong. 9, reward yourself. The characteristics of IS is that people tend to dismiss validation or compliments. Learn to pat yourself on the back and accept the compliments instead of automatically dismissing them. And then this 10th step, I'm not really sure about it. Fake it till you make it. So Dr. Valerie Young has a TED Talk. It's 7 minutes long if you so wish to listen. I listen at 2 times speed. Sharing is a start, but she says that sharing is a start, but it won't simply overcome it. Her quote that I took away from her TED Talk is, how to stop feeling like an imposter is to stop thinking like an imposter. It's similar to cognitive behavior therapy. It's replacing those shoulds with coulds, stopping those automatic negative thoughts that you have. For example, I should have been able to insert any procedure, TDP, central line, etc. I should be, instead of saying I should have been able to do that, because that gives you a negative connotation that you should have had that knowledge. I could have been able to do it, but I just wasn't prepared. I'll read over the procedure next time so that next time I'll be ready. It reframes that thought process and gives you the opportunity to do better the next time instead of just punishing yourself for not being, punishing yourself. Reframing allows you to talk yourself down faster. And this is the quote from her TED Talk. In order to stop having imposter life, where you feel like your entire life is a fraud. And this allows you to only have an imposter moments where you are challenged and feel afraid, which is normal, especially when encountering a new situation. More methods, and some of these methods overlap with the previous 10-step methods. Learn to internalize external validation. Like I said, take those compliments. You ran that recess really well. Take it, you did. Look in an accurate mirror. So I know Dr. Kim talked about being objective and looking at a mirror and making sure you're not overconfident, but also realize you made it this far for a reason. You made it through college. My goodness, 12 years. College, med school, You survived the residency interviews. You were chosen for this residency. You survived MICU as an intern. At the second U, you guys have survived SICU, CCU, NICU. You survived God knows how many notifications by that rep phone, and you were like so relieved when it's just a fire notification. But look at yourself in an accurate mirror and realize you have done a lot to get here, and you know more than you think. And then there is a lot more to learn too. See others objectively. Like they said, it's easier to compare yourself to others, but try not to. Your co-residents may be struggling. Your attendings may be also struggling with the difficult case as well. We all put on a strong face when we're at work, but inside the house might be on fire. And then look at your fear. Like we said, fear and being afraid is a perfectly natural experience, natural reaction to what you're experiencing when you're in a new situation. Feeling unfit for your position is a conditioned emotional response to stress. Distinguish the stress of moving up into new levels of responsibility from conditioned response of imposter fears. Like I said, take stock of your success, and then at the end of the day, talk to someone. You know, you can go to therapy. We have mentors. You have SIP family, your co-residents, people who are outside of medicine. And then in that survey, I asked the alumni, what methods did you use to overcome your imposter syndrome? 31 responses, okay? Some of them are similar to one another. So they said, time helps, and seeing over time what you are doing is the right thing for your patient. And I love this one. Tell yourself you trained at Kings Frickin' County. You're the best person to handle the situation, whatever the situation is. And then the last one I liked the best, you guys can read this. Just realize it's a thing. It's normal. Continue to do your best and check yourself for colleagues. Some of them, give myself permission to be wrong and to admit I don't know everything. It's a process. Sometimes it still happens. I like this phrase, I earn this place I inhabit, and I remind myself I have nothing to prove to anyone. I just have to keep my patients safe. And then any general advice for our residents, 27 responses. Keep learning. This first one I really like the best. Keep learning. The second you think you know it all is when you're actually an imposter. And then this last one was kind of funny. You're getting some of the best training in the world. You are imposters. Trust me, you'll meet them. They went to Methodist. I was like, hey, I don't know who you be. These are all anonymous. And then, you know, this is a little self-serving. I asked them for any advice for new grads, and they were very long. All right, you will make mistakes. Don't be too hard on yourself. View your errors as opportunities to learn and improve. Your best protection against medical malpractice is not clinical perfection, but rather to be kind, thoughtful, and compassionate towards every patient, and to be transparent. Try to share your thought process with your patients and families so they understand that sometimes difficult choices you are forced to make. The end of residency is not the end of learning and growing. And then this one I really liked. You've gotten better at training than most, but even seasoned doctors have blind spots. It will look like people who have been out for a while are moving so much faster. Don't fall into the trap of moving too fast. Some patients will always require more care. It's okay to take the time you need to figure a patient out. It doesn't make you lesser than. That's what training in our program makes you good at, knowing your limits and knowing the sick from the non-sick. So all these responses I will send out to you guys. You guys can read at your own leisure. Okay. And then reflection. So I gave this lecture 2 years ago as a second year. And I remember as a second year looking at my seniors. Dang, they are so good. Everything, they're just saying it's fine, it's fine, it's fine. They're handling the room, they're handling CCT, even though the room is on fire. And then I became a third year. And I was like, I was in charge of the room. And this is how my head felt. And imposter syndrome reared its head really, really strong. All right, I think my first resuscitation in UHB, I had 3 period bradycardic arrest. and one of them was stable, and then she expired literally 30 minutes later. And that was horrible. And I had a horrific time. I overcompensated, I studied, I wasn't sleeping very well, but you know, over time, I got better. And now, this is how I feel sometimes when I'm in CPT or when the pot is blowing up and nothing is going right. And I can only imagine when I'm new attending, coming out, I'm gonna feel like this again. But I recognize, even though I had given the lecture as a second year, and then I felt these experiences as a third year, I didn't recognize I had imposter syndrome, you know? And then only talking with my co-residents, because my co-residents were like, oh my God, they're amazing. And then we were talking to each other, and I realized they were also experiencing it too. And they were also comparing themselves to me, and they were saying, oh, you do so well, you're doing so well. And I'm like, no, this is how I feel. So imposter syndrome affects everyone. Your seniors may feel like they may look like they're running the room really well, but in their head, they're like, oh my God. And then as a junior, as you guys, you know, we're at the end of the year, everyone's going to be transitioning into new positions. First years into second years becoming seniors. And I know there's a lot of anxiety. There can be a lot of anxiety with that, and it's normal. And you know, you have a lot of co-residents, you have a lot of attendings who are supportive, and you don't need to know everything. The only thing you need to do is, not only thing you need to do, but what I advise is just compare yourself to only yourself. I say this a lot to our juniors. You can only be better than the person that you were yesterday. And that's all you can really ask of yourself, and keep trying and learning. And hopefully I can be like this when I'm attending. And you know, this is an opportunity if anyone else wants to talk about themselves, if they have ever had experiences of imposter syndrome themselves, this is a moment for you to say or think about it.
All the time, it doesn't go away. I'm actually shocked that people would say they've never had imposter syndrome. That concerns me. I guess we can reflect back to Eden, which I think if you're feeling like you're generally felt like an imposter, then it's how you grow. I think how you deal with it and how you talk to other people about it is important. Every one of us has compared ourselves to others and
so not so much on imposter syndrome, but more as perception. So I don't know how many years ago, like maybe 15 years ago, I kind of read this article that you cannot measure yourself with someone else's ruler or someone else's like success, because you can only reflect for yourself and not based on what other people did. So I did like myself, I do like a daily reflection ever since then. And let's say that as intern, right? 365 days a year, you do reflection every day. And if you can improve yourself 1% each day, like a year later, you improve yourself by 365%. So it's not something that you could do by like jumping in one week, but it's a progression, right? So as long as you don't give up in like learning and be humble, and you get better in like over time. Like you said, like even the seasoned or the surveys say, like even the seasoned doctors like could make mistakes too. And what's important to learn from it and go from it.
I think it's very important to be kind to others, but it's also very important to be kind to yourself and not beat yourself up too much. Have to find that happy medium. And I think we've seen some tragedies where I think some people beat themselves so much they just can't go on for whatever reason. And then this last year or so has shown that. You just got to be kind to yourself. And when you need help, you have to reach out for help. One good thing about this program, and I'm even comparing it to the program that I ran, I think one really good thing about this program, and nowadays compared to what it was, is the emphasis on looking out for each other and looking out for the residents. That wasn't there when I was training as much. And I think this program does a really good job with it. And I think nobody's perfect. But I think this is important, and having a lecture like this is very important. I really think it is, not just talking all the time about LPs and so finding ideas and all that stuff, but you have to talk about this stuff. You really do, and that's a change for me over the years.
I think one of the most important things you said is talking to other people. Because like you said, sometimes it's like this downward spiral inside your head. I messed up. And then you talk to somebody else. First of all, when you hear it come out of your mouth, you realize, wait, maybe it wasn't that bad. Maybe it wasn't that crazy. And even if you did mess up, which you all will, we all mess up. We all make mistakes. But just talking it out, if another person would be like, oh yeah, this is my experience. A lot of times we talk to the right person, be like, yeah, I messed up like that. This is what I missed in my past. And you realize no matter who everybody else is, you can talk it out with somebody. And sometimes not even about talking with a colleague, sometimes just talking with a significant other or a friend who doesn't even know anything about medicine, but saying the words out loud prevents that kind of downward spiral that you're talking about in your head. And I think it's really important that you talk about the things that you worry about. It doesn't matter who it's with, even. A lot of times it helps to the colleague because then they can say, hey, what you're saying is it's not that bad. You know, very few, you're going to make mistakes, and it's okay, but very few are like such terrible, awful mistakes. You know, we wouldn't let you into the program if you're going to make such terrible, awful mistakes.
I think it's okay to accept that we're never perfect. And I think that sometimes that accepting is takes time. Acceptance by others is also going to take time. But you just have to know, say sorry when you can, accept when you made a mistake, and talk. Talking to you is the best. Let's do it.
All right. And that is the end of my lecture. Thank you. These are my references.